gives me great pleasure to introduce the first speaker, Dr. Fernández Pérez from Almería in Spain. He's going to be talking to us about the prediction of visual acuity and contrast sensitivity from ray tracing simulation to clinical evidence. Joaquín?
Okay, thank you very much, Satish. Well, the idea of the presentation would be, well, this is our... The idea would be, of course, all of us, we know that to manage adequately the multifocality with our patient is try to balance the expectation with the outcomes that we are going to achieve. And this is possible that our patient educate adequately what could be the outcomes, manage so the expectation. Well, all the presentation is to tell you that exactly we can do it. Well, right now, what method we have currently to predict before surgery the visual performance after surgery? We could have method for the individual estimation, and we could have method for mean population estimation. On what side, the simulated IOL or the real IOL, and then the mean population with evidence and also model of prediction. This is more or less the equipment that we have right now. In the simulation, we have two equipment. First of all, SimVis is like a glasses, virtual glasses, that the software of the lens have more or less the possibility of seeing, that the patient could see in a normal scenario, and the VAO adaptive optics, that is only an equipment with a monocular vision, and you cannot see the normal scenario. And then in the real IOP, there is like an optical bank inside your clinic. You can put inside an intraocular lens, a multifocal, and you can see through the IOL. It is another equipment, but not clinically at our disposal. But what happened? What is the idea with a visual simulator? The idea is to see, to verify the visual performance at the implanted patient from the preoperative measurement. So try to simulate the situation. But we need to know that we need the previous validation. If we have a problem, if we have a patient with cataract or sclerosis, of course, he's not going to verify exactly how he's going to see in the future. And only in some equipment can see exactly the sensation of the photopsia, not in all. Talking about the mean population, of course, probably you are doing right now all these things. You are seeing some papers like ours and in other group. You can see more or less the mean population, and exactly this is the vision that you are going to have with Liberty. You are going to see that it's very consistent, our paper with other paper, and you are going to see with Liberty in monocular condition. What happened with this paper? Of course, it's the most reliable information that you are going to have, but the result can differ in between research method of analysis. And of course, sometimes you want to see, you want answer for an answer question. For example, with what kind of amount of pupil could reduce the less distribution focus of each lenses? So, well, we would like to know a deep knowledge about that. And right now you are having a very interesting predicting models using optical quality meter. Using the MTF, you can measure in the optical band, the MTF, you know the MTF is the quality of vision. The MTF is more or less the quality of vision in clinic is the contrast sensitivity, and the optical band is MTF. And you can correlate these MTFs in the optical band with some size of patient implanted with this lens. But what happened with this prediction model? Right now, the model that we have is only for visual acuity, not for contrast sensitivity. And also we have a threshold of 20 of MTF that below that, above that, we are going to have always 20/20 vision. It's not too discriminative. And the most important for the prediction is to consider multiple spatial frequency, not only one frequency, okay? So right now, we propose you a very interesting work that we are doing with Medicontur, with a set of patients implanted with Liberty, and we are creating not an optical band model, but as you can see, a we are creating by ray tracing with all the biometric eye parameter, an eye model made by ray tracing, okay? And then we compare, we correlate with the outcome of this lens with our application to measure the defocus curve, not only in visual acuity, but also in contrast sensitivity, and we create the correlation. So the advantage of this method is that we are going to have a predictive model, not only in visual acuity term, but also in contrast sensitivity. And we are seeing that you can verify with this predictor model what could be the behavior of this lens in different size of pupil. As you can see, when we have a pupil of reading is a little meiosis, the behavior is incredible, improving the near intermediate. And when we have a big pupil, like in night driving condition, we are going to have an improve of the visual acuity for far and reducing the halo, as you can see in SIMAP in the Liberty, because they have, this lens have only 7 rings. And this is very consistent with the outcome that we are having in visual acuity and contrast sensitivity in our patient. It's exactly the same. And we discover that the correlation with the MTF and visual acuity is less dispersed, is more consistent, but it gives us less information. It's very interesting to know more and more information. It's more discriminative, the contrast sensitivity, as you can see in the right hand, but we need more sample. We are creating more sample for our people with our study, because it's going to be more knowledge, more deep knowledge, as you can see here. So it's very consistent, the idea, the prediction that we are having is only having difference of 1 line in visual acuity. We have more differences in contrast sensitivity, but increasing our size, we are going to have more consistent knowledge. And we could mix this concept with the MTF that we are having. This is from the last year, in the difference of the trifocal that we are having in the market. And all that we know of this information at the Liberty comparison with the other trifocal, you have in the right the near focus, you have in the left the distant focus, and Liberty is all the trifocal lenses we are having. We achieve the highest peak in the near vision, and we also have a wide focus in near. So we have an enough idea of the near focus. And as you can see in the far focus, this space in black is the most quantity of NTF, so it's also bigger than in the other trifocal lenses. It's having an incredible vision for far, and the peak is highest and is wider than in the other trifocal lenses. And conclusion, we are going to have with this prediction model more information for you with different parameters, not only pupil, but for example, spherical aberration or whatever you want to know. And you are going to have a rule exactly to try to predict the most exactly to possible our patient. As you can see here, the behavior not only in visual acuity, but also in contrast sensitivity, the line that you have is the 0.3 logMAR visual acuity. So it's the utility, the vision util for useful for our patient. So in all conditions of pupil, this Liberty lens, the behavior is good enough for our patient, but in far and in near vision, the behavior is absolutely incredible in comparison with other lenses. Thank you very much for your attention.